Hello and welcome to NAFDAC and your else. My name is Tosin Omolaja, and here's where we bring you up to date with NAFDAC's activities with regards to its mandate of safeguarding the health of the nation. Thanks for joining us for another insightful edition of the program. As the country and indeed the world continue to battle COVID-19, this week on the program we turn our focus to food. To guarantee food safety and safeguard the health of the nation, NAFDAC prioritizes good manufacturing practice (GMP) for all food producers in the country, irrespective of the kind of food being produced.
Good manufacturing practice is what NAFDAC looks out for when we go out for inspection and when we go to facilities or production facilities, whether they are producing food, water, or anything that we need to use or that requires NAFDAC's attention. With regard to food, good manufacturing practice is the system that you have in place, in any facility that ensures that whatever you have designed into the product is consistently reproduced, okay? Meaning that whatever is produced on Monday will taste exactly the same way with what was produced on Friday or what will be produced on Thursday. That is consistency, and it is how your system has been structured that will enable you continuously reproduce the same quality and the same standard, of products.
Good manufacturing practice extends to even personal hygiene of food handlers. Food handlers are expected to not only be clean at all times, but also be excellent in medical status. This is referred to as good hygiene practice, and NAFDAC takes this very serious.
There is nothing so complex about good hygiene practice. They are basic hygiene requirements that are expected of any person, even in the home, but much more so for people working in food manufacturing facilities. And one of it is to ensure that the food handlers are medically fit, to be able to handle food. And the reason is because if they are not, they could be vectors. They could be, transfer microorganisms or disease-causing organisms onto the food. Then, of course, basic hygiene requirements like hand washing, like ensuring that fingernails are short, earrings and rings generally are taken off, when production of food is being undertaken. As much as possible, food handlers should ensure that sneezing and coughing, are avoided. Of course, this is even very much emphasized in this time.
Despite the restriction of the novel coronavirus pandemic, the agency has continued to play its regulatory roles, whilst ensuring that its personnel are safe and secure.
The COVID pandemic has really affected a lot of things. It has really affected NAFDAC's regulatory functions. We have been struggling to really keep up with our responsibilities because we know that we also don't want to put our officers at risk. In fact, the DG is very particular about this, and because of that, we take extra precaution. We know we still have to safeguard public health. So despite or in spite of the hazards that are around, we have devised ways of safely carrying out our functions, and that is by providing staff with the required PPEs so that when they go into facilities, they are properly clad and protected. We have masks and overalls, gowns that have to be worn, to facilities. And we have already started going around to factories. In fact, last week, we already closed down about 6 water factories that we visited, and although they were not expecting us because they didn't know we had already started going back to, we're back on the beat gradually. So we shut down 6 facilities last week, in Lagos, and around the country the staff are beginning to go around to look at the facilities, gradually. And because it is important, that we are running away from COVID, there are other things that could also endanger our health, and that includes poorly prepared food or contaminated food or other things that could cause danger to health. So we are conscious of this, and we're actually going around.
Some water bottling businesses were met with regulatory sanctions and their facilities shut down, having found to have deviated from the standards on which they were giving approvals to bottle water by the agency.
Officers carried out a routine inspection recently based on the complaint that we have been receiving from members of the public regarding the quality of water that is made available to them. And we discovered that despite all the measures that the agency has put in place to ensure that only safe and good packaged water is made available to the public, because that's one of the cardinal products that we regulate, we discovered that some of these manufacturers are not conforming to some of the laid-down procedures that we have given to them. We have actually put in place some measures like good manufacturing practice, laboratory analysis of products, and registration of products to make sure that some of these people comply. But during our field survey, we discovered that most of them have completely deviated from what they are supposed to do. They produce in an unhygienic environment. Some of them, when we register them, they have qualified personnel. But we discovered that immediately after the registration, they do away with the technical officer that is qualified and employ maybe a packer to be in charge. Most of them, they disconnect the treatment plant and the UV sterilizer. Most of them, they don't use the appropriate chemicals for the filtration process. And most importantly, we discovered that most of them don't even code their products. So those are some of the lapses that we have observed during our field survey. And we felt that we cannot continue like this, and that's one of the reasons why we have to ask our officers to go out on the routine inspections, so that we want to meet these manufacturers as they are, so that we can be able to take necessary action when we have non-conformances.
We don't want to lock down facilities, and that is why we're announcing that we have resumed our routine inspections, and we will be coming to your facility sooner than you think. And why this announcement is necessary is for the people we are regulating to actually clean up and make sure they maintain the standards that are expected. We don't have any interest in locking facilities or punishing companies for doing what is wrong. We want you to do what is right, so that the punishments will be avoided. And that is why when you look at the NAFDAC tariff, the administrative charge, for some of these activities are really, very, very high, and they can make you very uncomfortable. So we don't want to penalize you. So we want you to be compliant so that you avoid the penalties or whatever charges could be due to certain non-conformances that will be observed. Most importantly, we want the manufacturing sites, the producers, to please observe all the good practices. When I say good practices, we have good manufacturing practice, we have good hygiene practice, we have good distribution practice, we have good storage practice, so many good practices, good laboratory practice, all the good practices. There are guidelines and requirements that should be followed and should be met to ensure that you are compliant and you fall within what is expected of those good practices. So this is what we expect, and moving forward, NAFDAC will be enforcing and ensuring that all these good practices are observed by the people we regulate.
We'll take a short break now. Don't go away.
Yes, come in.
Uncle.
Tayo.
Yes, sir.
Welcome. Thank you very much, sir. It's good to see you. Where's Junior and his mom?
Uncle T, we are here.
Mama.
Junior, quick. Go get your uncle some alcohol from Auntie Carol's shop.
No, Junior. Please go sit. Don't you know that sending Junior to go buy this kind of drinks could instill in him the urge to drink alcohol at this tender age? Children under the age of 18 should abstain from alcohol. No, uncle, please. Give me the money. I'll go buy it by myself.
I didn't know that.
But I told you.
NAFDAC says alcohol is a no-go area for children under the age of 18.
I will never send him on such an errand again.
It is the business of all of us, parents, guardians, marketers and retailers, to stop underage drinking of alcohol in our society. Join us today. This message is brought to you by Distillers and Blenders Association of Nigeria, NAFDAC, and the Federal Ministry of Health.
Welcome back. If you are just joining in, you're watching NAFDAC and your rails. An important part of good manufacturing practice, which many food producers take for granted, are the environment of their production. And these have very crucial importance to the overall safety of the food that is produced.
We really want to appeal to people, to please think, to be on the side of lifesavers, not on the side of people who are causing, health problems, or even because some of these lapses can lead to serious or severe consequences that could even lead to death. So please, because food is not something you joke with, we have to eat food every day. We eat food to sustain life, not to create problems for life. It is meant to sustain life, whether you feed a plant, you feed an animal, chicken, or your goats or your cattle. When you feed them, you are feeding them to sustain life. And when we also consume food, we are eating food to sustain life, okay? And we also want to pay, we want the people we regulate to pay attention to the fact that across the food chain, there is a lot of involvement, everybody has a role to play across the food chain, okay? Right from the farmer to the people the off-takers who take food from the farmers, the people who take it for processing, and after processing, the people who even retail or sell the food. This is a whole lot of, activities that are involved, and everybody has a responsibility to play. There are good practices across all the stages. For instance, on the farms, we know there is what we call good agricultural practices, meaning there are certain things you must follow and you must abide with on the farm. There are lots of things, chemicals you put on the farm. You add to the fertilizers that you use, the agrochemicals that you use. There are processes and procedures on how to apply this thing. Even for animals, when you give them medicine, veterinary drugs, there is time we call withdrawal period that you have to wait for the medicine to clear from the system of the animal before you can now slaughter them for food, okay? So whether it is chicken, rams, goats, or cattle or cow, there is a time limit, prescribed before you can actually, from one state to the other, when you administer medicine, before you can actually consume those animals. And this is important because when you have some of the residues of these medicines in the animals, in the animal, and you consume this food, it leads to what we call antimicrobial resistance. For instance, if maybe you are supposed to take an antibiotic to clear an infection, and you already have your infection that is resistant to that antimicrobial agent because of the residues you've been consuming over time from other sources, that medicine will not work on you when you use it. So these are the things, and that is why across the chain, we have roles for everybody to play, and that is why those are the good practices we actually look at when we go to inspect facilities.
The consumer has a critical role to play in the food safety process. Consumers must be very alert when buying food items. This would go a long way in mitigating the negative effects of unwholesome foods and safeguard health.
labels that we place on food and that NAFDAC and all regulators have insisted should be on food is not a decorative item. It is information for you, the consumer, to use. You should be able to read your labels and find out what the components of this food are. For instance, for somebody who is allergic to nuts, or you're allergic to gluten, which is, protein in, So if you're allergic to those things, or you're allergic to milk, or you're allergic to fish, seafood, if you read the ingredients list on food, you'll be able to see that the food contains those items. And you'll be able to make a choice as to whether you want to consume the food or you don't want to consume the food. So these are some of the things that is important that we need to look out for. Furthermore, in addition, we also need to look out for the best before dates or expiry dates on the food, so that you do not consume food that has gone beyond its shelf life or best before date, because anything that is expired may not necessarily be safe for consumption. We should also look for knocks. When you are buying any food product, the container should be uniform. If it has dropped or maybe poorly handled and you find dents and whatever on it, those dents will be sources of contamination into the product. You might not see, there might be very minute cracks that will, that could have compromised the content. So whenever you are looking at any product, make sure you buy products that are, well packaged and sealed and without dents, around them. And then also, we want to encourage that whenever items are being picked up, ensure that the storage conditions specified on the products are maintained. For instance, if you are supposed to buy items that are supposed to be stored in the fridge, and then they are not stored in the fridge, they are stored on the shelf, definitely the stability of such products will be of concern. Do you understand? And then also, if you buy something, for instance, if you buy bread that should go bad within maybe 4, 5, 6 days, and you find out that the bread in your house is staying for 10 days, please report to NAFDAC. Something has been added that is making it stay longer than it should be, and it could be injurious to health. We know what the shelf life of some of these things should be. So when it is staying beyond that, you should actually be worried, especially for those bakery items like bread, and all these things. They shouldn't last more than 5, 6, 7 days, But if it is that is at room temperature when you place it on the bread, on the table.
Time now for NAFDAC update.
NAFDAC approves first COVID-19 vaccine for Nigeria. The National Agency for Food and Drug Administration and Control, NAFDAC, has given the first COVID-19 vaccine emergency use authorization approval. This opens a pathway for many Nigerians to get vaccinated for COVID-19, courtesy COVAX facility.
This is to announce that our first COVID vaccine, AstraZeneca Oxford COVID-19 vaccine, also called Covishield, has just been granted emergency use authorization by NAFDAC. The emergency use listing will allow Nigeria to receive the first batch of the vaccine from COVAX facility within weeks. The vaccine is manufactured as a multi-dose pack, either 2 doses or 10 doses per vial, and it can be stored at 2 to 8 degrees centigrade, which is a temperature that is suited for our own environment. It's a freezer temperature, our regular freezer temperature. 1 dose of it is 0.5 ml. In terms of how long it can keep stability data, the applicants has proposed a drug product shelf life, meaning how long it can stay on the shelf in the freezer. The freezer is the shelf now. It can stay there for 6 months. We also looked at vaccine safety and efficacy. This is extremely important because safety and efficacy are premium to us as regulatory agency, NAFDAC. Our goal is to safeguard the health of our people. So we looked at their data, and from the phases 2 and 3 conducted, COVID was found safe and well tolerated in adults above 18 years old. The incidence of solicited or unsolicited adverse events or serious adverse events was comparable in the study control. No causality-related serious adverse events was caused by the study vaccine.
NAFDAC has prepared for the COVID-19 vaccines in every way required and have efficient platforms already in place, including adverse reaction reporting and pharmacovigilance.
Safety of the vaccine is premium to NAFDAC, and a lot of efforts are being put into this regulatory function. The agency initiated multi-stakeholder collaboration with National Primary Health Development Agency, Nigeria Center for Disease Control, UNICEF, Gavi, WHO, and Ministry of Health. The focus is to use a holistic approach for the effective immunization or delivery of the vaccines, that is by primary health, and monitoring of any side effects following immunization. This will be done with NAFDAC and Primary Health and NCDC. The agency will be using its recently launched Med Safety app for active pharmacovigilance of the vaccines in collaboration with the sister agencies that I've mentioned. The app is free, and millions of healthcare workers can download it for free in order to report adverse drug reactions. NAFDAC also plans to use the traceability with GS1 technology to monitor the vaccine distribution using Global Trade Item Number or GTIN. This is to prevent fake vaccines from infiltrating the supply chain and to ensure that there is no diversion.
That's it on NAFDAC Update. You've been updated.
That's our package for today. Please join us again, same time, same station next week for a fresh edition. In the meantime, if you have comments, complaints, or you want to report activities of fake drugs or adulterated food product peddlers in your area, our doors are always open. You can reach NAFDAC via toll-free numbers. For inquiries, call 0700 162 3322. For complaints, call 0800 162 3322. You may also email NAFDAC at nafdac.gov.ng. If you have complaints about any form of misconduct, you can reach the Reforms Unit via email reforms@nafdac.gov.ng or call the Reforms hotlines on 0909 763 0506 or 0909 763 0507. NAFDAC, customer focused, agency minded. Remember, COVID-19 is real. Please ensure you and your family follow the safety measures as outlined by the NCDC. Stay away from crowded places as much as possible, and if you must be out there, please wear a face mask. Wash your hands regularly with soap and water and ensure you use only NAFDAC-approved alcohol-based hand sanitizers. See you next week. Stay safe.